This is All India Radio. In the program Spotlight, now we bring you a discussion on Poshan Maha challenges and initiatives to tackle malnutrition. The participants are Dr. Umesh Kapil, former professor, Department of Gastroenterology and Human Nutrition Unit at AIIMS, and Aditi Tandon, journalist.
The National Nutrition Week 2020 is being marked from September 1 until September 7. As we all know, it's a very important time of the year when awareness regarding the value of nutrition and the need for good exercise and balanced diet is emphasized by the government, with special focus on children, because India's new health statistics, which were brought out through the National Family Health Survey, had painted a grim picture of child undernutrition. And although India has been making rapid strides in the health sector, the issue of child malnourishment has bogged down and has troubled various governments, and efforts have been made by one government as well as the other government. Every central government has made efforts to ensure that children are well nourished. So what is your take on the National Nutrition Week, and how do you see the progress has been made under the National Nutrition Mission?
This year, we are celebrating as a National Nutrition Month, Poshan Maha. So it will start from 1st and go up to 30th September. Now, the efforts which are going on by the Government of India are greatly appreciated. It is unlike the health sector where we, based on 1 or 2 or 10 diseases, we do have immunization or preventive vaccination against the common communicable diseases. But as far as malnutrition amongst children is concerned, it is multifactorial in origin. And it is not like you do one intervention successfully and then the nutritional status would improve. It requires the cooperation of multiple sectors. Like if nutrition has to be good, then if a child falls sick, then we need to take care of his health. So simultaneously, we have to ensure that all immunizations are being given to the child so that he doesn't fall into the common communicable diseases. Similarly, we have to take care of water supply and sanitation so that the child do not suffer from diarrhea. We need to strengthen our health infrastructure so that the health services are available to the child. We need to improve the status of the women in the community so that when the child becomes sick, the mother should be able to take the child to the local health facility. Similarly, we have to ensure that the transport is available, roads are good, electricity. So it's a malnutrition basically is an issue of overall development of the society. So whenever we have seen at any place, including our country, when the development is taking place, there is a reduction of 1 to 2 points per year in the prevalence of malnutrition. So it's a very uphill task, but I must say that the Government of India has taken up this issue slow and steady, and we are going to be successful in our mission. With the commitment of our Honorable Prime Minister, we can see that a lot of efforts are being done, and this year the strategy has been to find out the local foods which are available in each district, in each block, and we are going to develop an inventory of these local foods which are nutritious, which can, and the list for each of the district would be developed. These nutritious food should be encouraged locally. It should not be that some foods which are imported or from one state to another state cannot be promoted because it is not culturally acceptable to the families.
Prime Minister Narendra Modi, ahead of the Nutrition Month observation, said two very important things. One of the things that he said was about the creation of Agricultural Fund of India. He also said that this agricultural fund will have complete information about crops which are grown in every district and their related nutritional value, so that local communities are aware of the nutritious ingredients and the products that they have close in their vicinity. The second thing that the Prime Minister mentioned was a very interesting concept of nutrition monitor and nutrition card in schools. We are in such times that we also have the problem of obesity and overnutrition in sections of the population, and then there's the problem of undernutrition. How do you see the proposals of the Prime Minister and his announcements regarding these two, agricultural fund and the nutrition monitor and cards? Will they help on the ground?
Definitely, yes. because ultimately the food availability ensures that the poorest of the poor have the food available. If food is available, if there is a food availability, the market price are less. So we need to ensure that the agriculture sector is promoted. We should always have a surplus of food so that we are able to feed our population. I must admit that we have about 25% of our population which is below poverty line. That means they do not earn that much of money which can meet their daily caloric requirements. So that's one thing. So if we make sure that the food is available, then the Food for Work program, this Mahatma Gandhi Manrega scheme, all these schemes we can be able to provide food or raw food to the poorest of the poor when they undertake physical work in the rural area. Now, second issue is that it is not that de novo these lists of crops are being developed. We have an outstanding, excellent Indian Council of Agricultural Research. They have divided the country into different agroclimatic conditions, and based on that, they do have a list of crops which are available or which are being grown. That's number one. And they're able to predict the total crop production of different cereals and pulses and millets in each area depending upon their own monitoring system. But in any case, the effort from the Prime Minister will reinforce these issues, and I'm sure that this is going to go in a long way.
Family Health Fourth Survey of 2015-2016 had pointed out that the number of wasted children in India, the number and percentage of these children actually increased marginally from 19.8% in 2005 to about 21% in 2015. It was immediately in the aftermath of NFHS data that the government acted very fast, and a huge budgetary support was pledged for the National Nutrition Mission and Poshan Mah and Poshan Saptah. All these things came in. What do you think is the reason for this severe wasting amongst under 5 children in India? Because that's a huge issue and a great area of challenge.
If we look at the nutrition transition and nutritional indicators, we have 3 indicators to assess the nutritional status amongst the children. First is underweight, that is less weight for the age. The second is stunting, that is less height for the age. These 2 indicators are much more important than wasting, because wasting is affected when the child's height picks up fast, then the wasting increases. Similarly, the undernutrition. So the National Nutrition Mission has focused that we should reduce the underweight and the stunting in our children, which is extremely important. More recently, we have completed the NFHS 5, which the report would be available soon. I think so this under print. And in between the NFHS 4 and NFHS 5, we have the Comprehensive National Nutrition Survey, which was conducted by Ministry of Health and Family Welfare in collaboration with UNICEF. They are also providing us all the data. In the low-income group, we have a problem of underweight, stunting, and wasting. But if you go to the high-income group, we have a problem of overweight and obesity. This is something which we call it double burden of nutrition.
I was looking at the deworming project of the government because it's one of the projects that has done quite well. As you know, that the WHO had fixed certain targets for countries. And India is progressing well because the national deworming project is going on across the schools and children are being helped in this sector. I just wanted to understand from you, what is your take on the high burden of soil-transmitted helminths in India?
In fact, there is a debate which is going on that by deworming their children, what justification we are doing? Are we treating the symptoms or we are treating the cause? What is important is that reasons by which that worms infestation is taking place, that needs to be tackled first. Somehow what is happening is that we are not tackling the basic cause. We are tackling the symptoms. That is also important, there is no doubt about it. But again, I must say that the worms, they do consume the protein, they do consume the blood from our body, and that is the cause of malnutrition. But still, we need to take care of water supply and sanitation and other issues, related issues, so that the vulnerable population is not infested with worms.
Mr. Umesh, the Global Nutrition Report of 2017, you might recall, had sounded a nutrition alarm for India. It had flagged that over half of the Indian women in their reproductive age continue to suffer from anemia, which is predominantly an iron deficiency disorder. What is your take on anemia?
Anemia is an important public health problem, and in fact, if you look at all age groups, including men, they suffer from anemia of different grades, and the prevalence of a percentage of people suffering from anemia is from 30% to about 80%. There's no doubt about it, but we must remember that the anemia is multifactorial in origin. Our strategy has been giving the iron supplementation. Now the scientific evidence is suggesting that the inflammation, which is an important cause, inflammation due to malaria, tuberculosis, HIV, any disease that inhibits the absorption of iron. Second issue is that there, apart from iron, there is a vitamin B12, folic acid, vitamin C, vitamin A, zinc. They are also important etiological factors of causation of anemia. Now, what we are trying to do is, for last 70 years, 1970 to 2020, 50 years, we have been just giving iron supplementation. And iron supplementation was always given a low priority. Fortunately, since 2018, Government of India has initiated Anemia Mukt Bharat, and in which we have covered all the age groups. But again, we must remember that Government of India can sanction funds, but the utilization is by the state. And what happens is maximum 20% of the funds are utilized, and hence the procurement, distribution that suffers and doesn't go into the beneficiaries. And most important thing is that if I suffer from anemia, it is not a felt need of the mother or the child or the man. Like measles, it's visible to everybody. Anemia is not visible. This is an important issue, that there is no demand for iron folic acid tablets.
Prime Minister recently announced that a food and nutrition quiz will be organized on the MyGov portal, and there will be a meme competition as well on the nutrition issues during the course of the Nutrition Month. I think these awareness programs will also go a long way in telling people that eating right is important.
There's no doubt about it. The people should be made aware about it, that yes, these issues require a priority, but awareness leading to behavior change is something which is required. We have to ensure that the behavior of the people should change. And unless and until the behavior of the people will change, I would say honestly, it will take time. That yes, once that there can be two ways. One is awareness and second is punitive action. Now, kuposhan or malnutrition, we need to have a demand. Unfortunately, what is happening is that since 40% of the child undernourished, so a mother compares her child with another undernourished child. Now, this is important. They do not look at the child who is really normal for their weight or height. So for them, it is a fat child, which is wrong. So perception of the mother needs to be changed. And unfortunately, our feeding practices during the infancy, cereal-based, which is low in calories. So we have to ensure that the high-calorie food should be given to the child. And we have a ICDS program, which is implemented in more than 7,500 blocks in our country. It's an outstanding program where the mothers are being educated, children are being given supplementary nutrition, mothers are giving supplementary nutrition. So we are making good progress as far as the nutrition front is concerned in the country.
We could end the program with what Prime Minister Narendra Modi mentioned the other day. He referred to a very important maxim which is part of Indian culture. Yatha annam tatha manam. Thank you so much for your time.
Thank you very much.
You are listening to a discussion on Poshan Maha challenges and initiatives to tackle malnutrition. The participants were Professor Umesh Kapil, former professor, Department of Gastroenterology and Human Nutrition Unit at AIIMS, and Aditi Tandon, journalist. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app, News on AIR. This program is also available on our website, newsonair.com. You may email your opinion about this program at airnsttalks@gmail.com.